This video is for those people who suffer from premature ejaculation or who thinks that they suffer from premature ejaculation. Well, unfortunately, the internet is full of this magical potions and pills and ways to cure you from premature ejaculation, and unfortunately, most of them are just not working. Watch this video to the end and you will learn everything you need to know about the premature ejaculation, as well as some of the treatments and some of the tools that you can use to control the premature ejaculation or maybe even get rid of it. Let's try to understand what would be considered a premature ejaculation. For example, if somebody wants to have sex for 45 minutes, but unfortunately they come on 35th minute, or 40th minute, would you consider this a premature ejaculation? Or if your partner is expecting you to last 25 to 30 minutes and you cannot, would that be considered a premature ejaculation? Of course not. In medical terms, the premature ejaculation is an ability to have a sexual intercourse and not ejaculating for less than 3 minutes. So first, let's try to understand whether it's a medical condition or it's something you're born with. There are some medical conditions like inflammation of the prostate or rapid drop in testosterone or increase in estrogen, some of the other hormonal disbalances that can actually cause a premature ejaculation. As a matter of fact, the erectile dysfunction can also cause a premature ejaculation, and we'll talk about it in a minute. If it's a medical condition, you definitely have to address the medical condition. It has to be diagnosed first, and then there are different treatments to address whether it's a chronic or acute inflammation of the prostate or a drop in testosterone. By the way, if you would like to learn more about testosterone and everything you need to know, how to diagnose it, how to treat it, how to prevent it from dropping, and how to effectively naturally get it up to good healthy levels, you can follow the link in the bottom and you can go to my ebook where you're going to learn everything you need to know about testosterone. If you're born with it, then you may just have some hypersensitivity around the part of the penis that's responsible for the bringing up the semen, and ejaculating is not pathological, but there are ways to reduce that hypersensitivity and make you feel much more comfortable on one hand and make you last longer in a sexual relationship on the other hand. So now, assuming that you're actually born with this problem, what can be done? Well, let's start with very, very basic. Now, we're not going to jump into drugs. We're not going to jump into surgeries. We're going to start with a really, really basic method that actually work for majority of people. Method number one, contraceptives. Creating a barrier between your penis and vaginal walls. Condoms usually work really well because we all know, reduce the sensitivity of your penis. Some people claim that it at least doubles the time that they can have a sexual relationship. By the way, if it doubles the time, usually it takes you out of that clinical range. But let's say you're still dissatisfied with the length of your sexual intercourse. What else can be done? There are a couple of creams, some sprays that use, most of them, lidocaine. Why lidocaine? Because they reduce the sensitivity. And of course, you apply it on the penis, around the head and the bottom of the penis. And by applying it, you reduce the sensitivity. For most of the people, it will prolong the sexual activity. If you decide to use sprays or cream, you need to be conscious with the fact that you probably have to wipe it off prior to sexual intercourse. Why? Because your partner will be exposed to that cream or gel as well. What does it do to a partner? It reduces her sensitivity. Therefore, she will not get as much pleasure as she can potentially get without that cream inside of her. So you can either put a cream or gel and put contraceptive, a condom on top, or you can use a cream or gel and then wipe it prior to a sexual relationship. Another way to reduce the sensitivity is to pick the right sexual position. Now, it's important to understand that the bottom of the penis and closer to the head of the penis has those sensory fibers that make you come early. If you pick the position in which this part of the bottom of the penis has less friction against the canal, you will have less stimulant and most likely last significantly longer. Another very common method is stop and go method. It's very effective and very easy to practice. When you're just about to ejaculate, you just stop and you try not to move for about 10, 15, 20, or 30 seconds. It all depends how long it takes your body to readjust, and that urgency to come will dissipate. And then you can continue having sexual relationship until you feel that urgency again, and then you stop again. You need to talk to your partner. That's exactly what you're trying to do, because otherwise it will be slightly weird, but it's something that can be practiced and really work for majority of people. Now, some people often ask if stop and go method is actually safe or it has any side effects. In reality, as long as you ejaculate, there are absolutely no side effects. Of course, if you're practicing this technique by yourself and you go at it for 30, 40 minutes, and at the end you don't even ejaculate, there's nothing healthy about that. But if you're practicing it by yourself or with the partner, and you feel that you're getting a better control over your ejaculation process, at the end you actually ejaculate, it definitely has no side effects and no problems for your health. Another form of exercise is actually relaxation exercise. Now, in many of my videos, when I teach you how to perform pelvic floor exercise, we're talking about pulling the testicles in, engaging all the deep muscles of the pelvis. In this particular exercise, we'll go the opposite way. When you having a sexual intercourse, it's very important periodically to completely relax. We're actually going to cause a relaxation of the muscles, and that's the muscles that have to contract to push the sperm up into the canal. So by creating this relaxation, we are slowing down or stopping the process of ejaculating. Now, there's also a way to reduce the sensitivity by taking certain medications. Now, I really don't want to get into the medication part, but there are some medications that block in serotonin, and they usually work well on patients to reduce that hypersensitivity. By the way, when you consume the alcohol, and if you feel that the alcohol reduces your sensitivity, most likely those medications will work on you as well. Now, not a fan of medications in general, and if you can practice and train yourself, relaxation techniques, breathing techniques, different stop and go techniques, you may have very similar results as you are on medication. There are some other mental relaxation techniques that I've been practicing myself and teaching my patients and clients. So, give you an example. You're having sexual intercourse and you feel like you start developing that urge to ejaculate. Not only that you can slow down the sexual intercourse process, you can also start thinking about some foreign material. For example, all of a sudden I will think of the wind outside of the house, or I will think of the ocean, right? I just close my eyes, imagine the ocean. Think of some other activity that you may be doing right now. So just blocking that stimulation, mental stimulation that you have during the sexual activity can also slow down or even stop the urge to ejaculate. Now let's go into the invasive treatments. With invasive treatments, one of the most beneficial was found to be a circumcision. Now the circumcision, it's not only done for religious purposes, and it's not only done to keep things clean, it's often done to reduce the hypersensitivity of your penis. Once the circumcision is performed and you walk around with exposed head as well as the shaft of the penis, you are getting significantly more friction, daily friction around that area that becomes less and less sensitive. So of course, when you go into sexual relationship after that, you do not feel as much urgency to ejaculate just from a simple touch or friction around the head or the base of the penis. There are some other interventional methods that are used and showed some relatively good results. For example, injections of hyaluronic acid. It's not only done for the penis enlargement, it's actually also done to reduce its sensitivity. Usually it's being injected around the head of the penis, right at the base of the head. So the fillers, the hyaluronic acid fillers, creates a separation between the nerve endings that are slightly deeper in the tissue and the skin, and therefore you feel less sensitive as the sexual relationship occurs. Another method that often proposed by urologists is the denervation or nerve denervation. There are two different types of nerve denervation. One is performed by a thermal or very low temperature. Basically, you freeze the nerves. And the other method is radio denervation using the radio frequency machine. Even though nerve denervation is one of the methods to reduce the sensitivity, is not often used because its impact on the tissue, and quite honestly, there are some reports of development of erectile dysfunction or reduction in ability to have a normal healthy erection. So definitely not a fan of that method. There are some limited studies that show that shockwave therapy, that as you know we widely use for treatment of erectile dysfunction, can be also beneficial in treatment of the premature ejaculation. Now it's too early to say whether this method will hold and will actually show a great benefit, but if you are suffering from some decline in ability to have a healthy erection, and that, by the way, can also be one of the reasons why you start ejaculating prematurely, because you're rushing to ejaculate in a worry that you're going to lose the erection, that can actually become a very good method for you. It's going to repair the ability for you to have a normal erection, and of course, by doing that, will slow you down in terms of ejaculation as well. So now, if your sexual relationship lasts 2.5-3 minutes before you ejaculate, and it's satisfactory to you, and it's also satisfactory to your partner, do you need to do anything about it? The answer is no. On the other hand, if this short sexual relationship, 2.5 or 3 minutes, is not in satisfaction to you or in satisfaction to your partner, maybe then you need to learn what can be done to change that. If you've been suffering from erectile decline or premature ejaculation, please watch my video where I tell you how our program can help you to get rid of it once and for all without medication, injections, or surgeries.